What I'm about to say is going to offend a lot of cash-based physical therapists. If you're looking to develop confidence, this video is going to be perfect for you. My name is Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes, develop confidence, and thrive in helping people maximize their health and their life. When you look at cash-based physical therapists, a lot of times there's two different styles and everywhere in between. Number one, there's a passive cash-based provider. Another one is an active driving style cash-based physical therapist. The problem is most people, when they enter cash-based physical therapy, especially in their first 0 to 5 years, they have this passive-based approach. And now, what is it and where did it come from? It came from PT school. It came from insurance-based style of treatment, but also it's how we got involved in the field. A lot of us are very empathetic, analytical, OCD type A type of individuals. We want to help people. And because of that, we have a hard time hurting feelings. We have a hard time telling people what to do because all we want to do is help. And sometimes that requires making decisions. Now, if you look at it from a structural standpoint, you've had a lot of surgeons, care providers, a lot of primary care providers give patients scripts to come see us as physical therapists. And then the insurance dictated how many visits we had. So because of that, we never tell them how to tell the patient what the diagnosis was. We never had to tell them how many visits that was going to require. And then by the time they got to us, all we had to do was deliver on the thing that we love, which was the actual help. Now, you didn't like the structure and insurance-based care because you wanted to give them, freedom and independence, and you wanted to help people with more time, provide higher quality of care, personalized one-on-one care. Now, here's the problem. You're going to take that same approach and bring it over to cash. Now, you wipe out the surgeon, you wipe out the primary care, and you wipe out the insurance-based company. However, you still have to be able to provide the diagnosis. You have to still be able to provide the exact number of sessions that people require, and that's where the struggle exists. So when you look at a passive cash-based physical therapist, that is that person. The passive individual is the one who is concerned or afraid of delivering the bad news as a primary healthcare provider. I'm not sure it's the diagnosis. Well, I'm not sure how many visits you should have. So what I'm going to tell you is just let me just see how it goes. Now, what you've said is you wanted the luxury of being able to treat one-on-one through personalized one-on-one care, but not the responsibility to be able to deliver the bad news, the good news as a diagnosis, and the number of planned care sessions that they needed with confidence. So the passive individual has a unique approach when they work with patients. Think about a surgeon. Now, when we look at a surgeon, their typical response is less than 2 minutes involved with the patient case, and they can figure that out by looking at imaging. They can now come into a patient walks in, the primary care, the surgeon walks in, and they assess the ACL or whatever it is. And within 30 seconds, they're like, yep, it's torn. I can get you on the books for surgery next week. Which one do you want to do? And they come in so confidently. It's a yes or no answer. Now, when you put that same scenario into a physical therapist's hands, what do you hear? Think about it. Now you're watching, you're listening to this, and you're thinking, well, gosh, I would have been a little nicer about that whole thing. And I would have said, maybe it could be, and maybe it wasn't. And maybe we should just see how it feels. And that's a passive way of directing care. And when you look at what the patient wants, the patient is going to you as a cash-based physical therapist because they want answers. They want the confidence. They haven't been able to get it through their insurance. They didn't like the way that the surgeon approached them. They didn't like what the primary did. So they're outsourcing you for a different solution. But the problem is that you were previously insurance-based. You came over to cash. You didn't throw out the responsibility of the diagnosis or the plan of care. So you take the passive approach. That patient is not getting what they need solved only because you couldn't direct them in the direction you wanted. So if you find yourself struggling with being passive and not taking the active approach, that's an internal thing. No clinical skill is going to improve this. Your ability to say yes or no as an ACL is not just clinical skills. Your ability to navigate a tough conversation and say, this is not what you need, this is what you need, is an internal confidence thing. You're taking this passive-based approach because you're not confident in yourself. What you have to realize is that person is seeking you out. You have the most knowledge in this relationship. The patient is saying, I don't know what's happening. And you're saying, I kind of do, but I don't want to tell you. And I'm concerned because if I tell you, I could be wrong. And if I'm wrong, you're going to judge me. If I'm wrong, my peers are going to judge me. And so I'd rather, instead of actually providing you what I really feel and think, I'm going to say, let's just take it week by week. And it could be this, but maybe not. Why? Who's suffering in this whole scenario? If you're not the active physical therapist directing people and saying, these two are your options, I would go with this one, and it's completely up to you if you want to go with the other one. The problem is, if you don't take that approach and you are passive about this whole process, who loses in this scenario? The patient's looking for somebody to tell them what to do. The physical therapist knows what they want to say. They're fearful of telling them because they want to be judged internally, externally, and by their peers. So who's losing? The patient. So because that person can't conquer their own internal fears, this patient suffers. Why? And that's why they leave. So that physical therapist is stuck thinking, I'm not good at cash-based physical therapy. This is really tough for me. And that's why a lot of cash-based physical therapists struggle. That's why they fail, because they can't become that director of care. They can't be the primary healthcare provider. And the funny thing is, the American Physical Therapy Association fights for it. Our internal lobbyists to fight for direct access, yet we don't have the confidence to deliver on it. So we're asking for this great responsibility, the ability to do it, but then you have cash-based physical therapists who can't even deliver on that, even though they've left the job, they found their perfect scenario, they had all the equipment available to them, they're in their dream scenario, you may or may not have mentorship, and you have the skill set to do it. But no matter what, there's still the underlying core root of why you can't be successful. And that's because you're using that passive-based approach and you're concerned and you're scared of directing people and telling people. And that's what surgeons are phenomenal at. They can tell people, this is what it is, and these are your two options. Which one do you want? And they can just stare at them in the face. Now, you might say, well, gosh, some of them are harsh and everything else. Fine. But you can't go the other direction of a very soft, hippie, passive approach of like, well, it could be this and it could be that. That patient is not looking for that. It's probably somewhere in the middle between hippie and surgeon is probably where you can do exceptionally well. Now, you don't have to change your whole personality, but you can be genuine about this whole thing. And you have to develop that internal confidence to be able to say, yes, this is it. No clinical skill, no mentorship, no perfect exercise equipment, and no more CEUs are going to solve this. This isn't an internal struggle. And if you can't solve this, you got to get out of cash. Like, you just won't survive. You'll fight this uphill battle. And I've seen it with a lot of cash-based physical therapists. They try and work around it. They try and go get more clinical skills. They try and find mentorship. They try and find CEU courses. They try and find work with surgeons, all to search for the internal thing where they're making themselves look externally good by getting more skills, more credentials, all those other things, but they're still fearful. I don't want to say the wrong thing. I don't want to tell them what to do. What if I'm wrong? That fear doesn't go away with just experience, because I've seen even people cash-based who enter cash-based 10 to 15 years after doing insurance, and they come in with that same problem. It's not years of experience. The problem is that insurance-based person wasted all this time on clinical skills that are irrelevant in the cash-based setting. The clinical skill is not going to help directing their care. You got to be able to prove it past that initial evaluation, past the first 2 visits. You don't even get to express clinical skill until visits 2 to 5. So what they're looking for is that direction, and that is an active, directive cash-based physical therapist. So if you are a passive cash-based physical therapist, you will struggle. And the best advice I can give you is find somebody who can mentor you on that, not just clinical skill. I think clinical skill is fantastic, but if you're stuck on this, no clinical skill will get you out of this. And it's realizing and identifying you have an internal struggle with telling people what to do, and you got to be able to conquer that. What's the struggle? What's the worst case scenario that would happen? Would this patient not come back? They weren't going to come back anyways because you weren't directing them. Okay? The patient might be like, whoa, that's a little harsh, but I appreciate it. And you earn my respect and confidence. That's fantastic. Worst case scenario, this patient wouldn't see that it's a good relationship with you, but at least you're authentic and telling them the truth. That patient now can shop around with whoever they want to be able to find their best resource. And if you are the best resource and you can do this with confidence, have more patients who want to be on your schedule because you're a truth teller and they haven't been able to find that in a single physical therapist in your local area. The only people who are probably doing that are probably your surgeons and your primary care physicians, and probably the customer service representative on the insurance company. Why? Because they're used to being declarative. This is just what it is, and this is your options. Physical therapists, where we live in this harmony hippie world where it could be this. I just want to listen to you. I want to help you. I'm just here to help. That person's not looking for that. They're looking for solutions. So be less of a passive cash-based physical therapist and be more of an active one. It's the best things I can tell you, especially inside your first 5 years of practice as a cash-based physical therapist, because it's a long process to do this, because it's an internal challenge that nobody has ever questioned you on, because you were able to go bypass it with good grades, bypass it with the test, and then you have to engage with humans. That's been the challenge. Now you're trying to tell them that they're delivering bad news and we're not used to that. And because of that, that's where the struggle is. The irony, we want direct access, we want to see patients, one-on-one, 60 minutes. And then we do, and we're like, whoa, we don't want to be the bearer of bad news. I kind of like the surgeon. I like the surgeons doing that for me and the insurance telling them what to do. I just want to deliver on the care. Does that sound like you? Probably because you're a passive cash-based physical therapist. So I hope this helps you. A nice little rude awakening to be able to help you thrive and not just survive in a cash-based setting. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.